Hello everyone, my name is Stephanie Spicer and I'm a Lyme. I'm not a doctor, so this isn't medical advice, just what I've learned through personal experience and through reading. As I mentioned last week in my video about Babesia, I'm not going to make a video about every possible Lyme co-infection, but I did want to make one about Babesia and one about Bartonella, which along with Borrelia form what I like to call the dark triad, a term used in the world of psychiatry to describe the cluster B personality disorders, psychopathy, sociopathy, and narcissism, which in many ways seem to mirror the physical disorders of these three diseases. Bartonella is the second most commonly reported co-infection of Lyme disease. If you have Lyme disease and treatment isn't working or has plateaued, you might want to consider if you have this infection too. This video is meant to be a basic introduction. There's a lot of information out there about Bartonella, and I'd encourage you to continue reading on your own. There are a number of Bartonella species and subspecies that are known to infect humans. Infection caused by Bartonella is called Bartonellosis. Some forms of Bartonellosis caused by the various species include cat scratch disease, Carrion's disease, also known as Oroya fever or Verruga peruana, and trench fever, also known as 5-day fever or Quinton fever. Carrion's disease is spread by sandflies and is found only in the Andes region of South America. Trench fever is spread by lice and was common among soldiers during World War I. Today it persists strongly amongst the homeless. Cat scratch disease occurs worldwide and will be the main focus of this video. Other species of Bartonella cause other problems as well. Cat scratch disease is carried by cats, dogs, coyotes, foxes, rats, bats, mice, and squirrels. Cats are the main reservoir of the disease with an estimated 40 to 60% infection rate. Younger cats are more commonly infective, and while cats can become immune to the infection, dogs and also humans may be very symptomatic. Cat scratch disease is spread by the cat flea. It can also spread via an animal scratch or bite. Ticks can also carry and spread the disease. This is how Bartonella works. After entering the body via the scratch or bite, the bacteria immediately set up a colony in the endothelial cells. These are the cells that line the interior surface of the blood vessels and the lymphatic vessels. Endothelial cells form the barrier between vessels and tissue and control the flow of substances into and out of the tissue. Every 5 days, some Bartonella bacteria are released into the bloodstream, where they infect the red blood cells. They invade the phagosomal membrane of the blood cells, where they multiply and use the red blood cells as a food source. The symptoms of Bartonella are mostly related to the damage they cause to small blood vessels. Symptoms of cat scratch disease include tender, swollen lymph nodes, so-called stretch mark lines around the midsection of the body, foot-sole pain, especially noticeable in the morning and sometimes described as walking on glass, headache, chills, muscular pains, joint pains, backache, malaise, relapsing low-grade fevers. I put these all together because they're symptoms of most of the tick-borne illnesses. Digestive system problems, heart problems including endocarditis, eye problems like conjunctivitis and Perinaud's syndrome, demineralization of the teeth and jaw causing face and neck pain, and severe psychological problems caused by meningitis, encephalopathy, and meningoencephalitis. Bartonella testing is tricky, and I'm not going to go into it in this video. If you want some in-depth discussions on it, I'd recommend checking out the YouTube channel Bartonella Babe. If you're watching this video, it's likely that you either already have Bartonella or suspect that you do. Nevertheless, let's take a quick look at prevention. If you interact with cats or other possible carriers, be sure to use appropriate flea prevention measures and to clean any bites or scratches with antimicrobials. According to the official consensus, most cases of Bartonellosis clear up on their own. However, in some cases, the organisms disseminate to infect the liver, spleen, eye, or central nervous system. These long-term chronic infections should be treated with antibiotics. Antibiotic treatment of advanced Bartonellosis can be complicated and difficult. Here are some reasons why. Different species of Bartonella may require different treatments. Bartonella infections can be embedded deep within the tissues where it's hard for antibiotics to reach them. Bacteria may be protected within biofilms. Bartonella has a stationary phase, a form of hibernation like Lyme's cyst form. None of the recommended antibiotics are completely effective. Bartonella can develop antibiotic resistance quickly. Different antibiotics have different pros and cons. Some only work to suppress the disease from spreading and don't actually kill the bacteria. Others do kill it but may have serious side effects. Some kill well within the blood but don't reach into the central nervous system. Some work well during the bacteria's growth phase but work poorly during its stationary phase. One strategy is to use several different antibiotics in succession to take advantage of all their strengths. Antibiotic treatment for long-term infection should last at least 3 to 4 months. It's important to do supportive treatments like supplementation, detox, immune support, and inflammation control during antibiotic treatment. These strategies should apply to both conventional and natural or non-pharmaceutical antibiotic regimens. I'm not going to go into what types of antibiotics and herbs are currently being used for Bartonella, but I'll put a link in the description to a detailed video by Dr. Joseph Burrascano. Bartonella is another one of these debilitating diseases that ravages our bodies and our brains and that doesn't have a clear-cut treatment plan or cure. One statement I read while I was researching this video was, "The primary treatment is supportive." And unfortunately, this is the attitude I see a lot of doctors and patients take. Rest, cut out more foods from your diet, don't do anything that might in any way aggravate the infection. And what? Wait for it to go away? It's not going to go away unless we fight it. Yes, do supportive treatments, but fight back too. We may not have the perfect weapon, research is incomplete and probably always will be, but if we do nothing, the infection will just get stronger and take more and more of our life away. These diseases are like bullies, and bullies will not leave you alone if you try to placate them. If you're too sick to treat and everything you do gets a strong reaction, start with detox. Start somewhere. Start today. Don't just lie down and take it like a punishment. Which infection should you treat first? It's a complicated question. On the one hand, you want to be able to give the needed attention and focus to each disease individually, and make sure to carry treatment through to recovery. But in the meantime, you don't want to ignore the other infections and let them get out of control. Here's what I think. If in doubt, anything you can do to fight any of the infections and lower the load of pathogens that your body is carrying is a step in the right direction. If one infection is particularly prominent at any given moment, hit that one.